Case number 6 was the 7 centimetre kidney tumour from a female of 66. And this is a metanephric adenoma. Case number 7 was the 63-year-old male with a 6 centimetre kidney tumour involving the highlight aspect of the kidney and renal pelvis. Because of this, the possibility of a transitional cell carcinoma was raised. And this is a particularly aggressive type of tumour called a collecting duct carcinoma. Case number 8 was the 76-year-old male with a kidney tumour that was encapsulated and circumscribed and also necrotic. This is a papillary renal cell carcinoma type 1. Case number 9 was a 35-year-old female with a kidney weighing 923 grams. No normal kidney was seen. This is an Angiomyolipoma, and the patient was known to suffer from tuberous sclerosis. Case number 10 was another young patient, this time a male of 32, presenting with hematuria He had a left renal mass 5 cm across with a cystic yellow cut surface. And this is a translocation carcinoma. Further studies revealing a TFE3 rearrangement at the XP11 gene locus, confirming the diagnosis of translocation carcinoma.